When the incident that causes the death is separated in time from the actual death because a person's been in a coma or been hospitalized, there are challenges for the medical examiner. For instance, one of the things that's difficult is you don't know exactly whether everything's been preserved the first time around. So knowing, for instance, whether it's a suicide or an accident in terms of the drug levels can be difficult to discern if you don't have the blood to test 6 months later. Forensic pathologists, when they get a case like this, the most important thing that they can do is actually review the medical records in advance of performing the autopsy. So a forensic assessment doesn't just mean doing an autopsy 6 months later. It means also looking at the medical records from that hospitalization and specifically on admission. What did the CT scan show? What did the physical examination that the doctors at the hospital did show? What did the toxicology show if it was done? And then you have to still complete an autopsy and see if some of those findings are still around. It's not unusual for forensic pathologists to get cases where the incident that caused the death is separated in time from the actual declaration of death and the autopsy. That doesn't mean that a death investigation can't be completed. It just means that the death investigation is going to include review of the police reports at the time, as well as the medical records in the interim. So that's going to expand the complexity of the death investigation.